Before we look at the continuum of home care in detail, I would like to take this opportunity to thank our sponsors. These are the companies who have contributed financially to the Academy for Private Duty Home Care to help make these learning programs available to you at a reasonable cost. So we would encourage you to visit the individual landing pages for each sponsor and to use their products and services when possible. To begin with, I want to take you on a little helicopter ride up above the day-to-day busyness of running your private duty home care business to look at the bigger picture of home care in America. And the bigger picture represents this continuum, beginning with hospice, home health, home medical equipment, home infusion, and finally non-medical private pay home care. Hospice care is end-of-life care and began in America in about 1974 when the hospice movement came to this country from England. Named Cicely Saunders was a physician who came to lecture at Harvard and Yale, and the hospice program began here as the Connecticut Hospice. Home health care has been going on in America since the 1880s, but really became a business with a stream of revenue in 1965 with the formation of the Medicare program. Of course, Medicare is an acute care benefit, which means that home health patients must be homebound, they must have a skilled need, and they must be under the care of a physician. And so under the home health care, skilled care is provided for patients with acute illnesses and is paid for by Medicare, Medicaid, and private insurance. However, we also saw that there were many patients that had chronic conditions and didn't necessarily have a skilled need or were homebound but needed assistance with activities of daily living. And so we saw home health care companies expanding their services into in-home care covered by Medicaid waiver, other government-funded programs such as the Area Agencies on Aging and long-term care insurance, and then we saw the growth and development of self-pay. Home medical equipment is that service that provides beds, wheelchairs, walkers, canes, and other equipment to patients in their homes. Home medical equipment companies also provide respiratory therapy services, products, and supplies, as well as enteral nutrition services and supplies. The home infusion business is the section that provides antibiotic infusion therapy, intravenous therapy, and other specialty pharmaceuticals. Oftentimes, home health agencies work together with home infusion pharmacies to provide those services to patients in their homes. And then on the far right, we have non-medical private pay home care. And this is the sector that we're primarily interested today. As we look at this whole graph, we see that the lower right-hand corner falls under this category that we call private duty home care. And it includes not only self-pay, but those services provided under Medicaid waiver, other government-funded services, Veterans Administration, long-term care insurance, and other payers. What we want to focus on is this very lower right-hand corner, which is the self-pay non-medical home care business, and that's the part that we want to work with you to grow. There are 3 levels of care in private duty home care: skilled care, personal care, and companion care. And skilled care represents nursing care. There is some private pay nursing. However, the majority of skilled care is for ventilator-dependent children under the state Medicaid program and care for persons with traumatic injuries from workers' compensation or auto accidents. Personal care is the hands-on care of the elderly and the hands-on care of the disabled. It's providing assistance with activities of daily living, including toileting, bathing, dressing, feeding, and transferring. And this care is often provided by certified home health aides, certified nursing assistants, or personal care attendants. Companion care or non-medical care is offered by companions, sitters, and homemakers, and oftentimes companion care is live-in service where the caregiver actually lives in 24 hours a day to provide companionship and care for an elderly person. Oftentimes, private duty home care companies add services to the mix, such as geriatric care management, personal emergency response systems, medication reminders and medication dispensers, medication management, telehealth, and in-home monitoring. Over the years at Leading Home Care, we've gathered benchmarking information and data to understand the financial and statistical benchmarks for home care. We began this process in 2008 and have continued to gather data each year. This graph represents a range of data from companies from a year old to 10 plus years old, and looking at revenue, clients, hours of service, and other key indicators. One of the things that we learned from our research is that one size does not fit all in private duty home care. Startup companies range from $0 to $500,000 in revenue. These are in the first or second year in business. Growth companies are those companies from $500,000 to $1.5 million in revenue, the second, third, fourth years in business. Then we identified what we call the glass ceiling companies. These are companies that are stuck at $1.5 million to $2 million in revenue. They get stuck there for two reasons. One is the owner is working as hard as he or she can work, and because this is a relationship business, there's only so much that you can do to build relationships with new referral sources. And secondly, owners after 3-4 years in business that have been working very, very hard get to that $1.5 million or $2 million in revenue. They're comfortable with their lifestyle and their personal income, and they remain at that comfort level rather than continuing to grow the business. The beyond the median companies are companies from $2 to $10 million in sales. Oftentimes the owners of these companies had a clear vision of growing a larger company, and they blew right through that glass ceiling as they grew their company. And then we have the multi-location mega companies, the 10 million and up companies with 5, 10, 15, 20, up to 100 locations. And we'll talk more about the mega location companies in another video. The benchmark companies are those companies that have been in business for 3 years or more and were profitable in the benchmark year. In this case, the data is from 2008. And we see that the benchmark company, the median-sized company, is $1,466,000 in revenue. The cost of care for the median-sized company was $880,000, or 60% of total revenue, and the gross margin, that is, the money left after paying the direct cost of caregivers, was $586,000, or 40% of total revenue. Then we take those gross margin numbers and divide them up, and we see that of the 40%, about 3.5% is used for marketing, about 1.5% for recruiting and selection of caregivers. 12% goes to pay for office wages and compensation for office workers. 10% covers the rest of overhead expenses, and that leaves us 13% for owners' compensation and profitability. Now, these are median-sized companies, and we've certainly seen companies that are larger than the median and that are more profitable than the median. This analysis looks at the same information divided into franchise companies, independent companies, and certified home health agencies. And in a future program, when we get to benchmarking and financial analysis, we will look at this information in much more detail. If you have questions about any of the things that we've talked about in this video or other videos, please feel free to email me at Stephen, S-T-E-P-H-E-N, at leadinghomecare.com, or to give us a call at area code 502-339-0653. We want to thank you for participating in this video on the continuum of home care, and tune into other videos as we get into the 3 pillars of private duty home care and the 27 elements of a successful private duty home care business.